Welcome to the third series, the third presentation in a three-part series. Today, we're going to be talking about the managing the cost of cancer care financial health planning. I'm Angela Young, a patient navigator supervisor, and I'm co-presenting with a colleague of mine, one of the social workers, Amy.
I'm Amy Allen. I'm one of the clinical social workers for medical oncology here in Rochester, Minnesota, and I'm going to be the co-presenter today.
Okay, so today we're going to review the financial health planning component to this three-part series. For those of you that have previously attended the first two presentations, you will notice some of the information is repeat information, but we are going to go through some additional content. So really, we're highlighting some of the key points that we really want to focus, and then giving you some new information as well. So again, just as a reminder, financial toxicity is a term that a lot of patients will hear that we're acknowledging as a healthcare system is a real concern for the majority of our patients at some point in time during their cancer journey. This financial toxicity leads to a lot of stress around finances, and oftentimes we can see that as a barrier to cancer care. With a cancer diagnosis, a lot of costs come with that, new costs that you haven't necessarily budgeted for. There's medical costs related to things like treatment, new medications, co-pays related to specialty visits. Sometimes there's over-the-counter medications or medical supplies that aren't covered by insurance. And then we have all those non-medical costs, things like transportation, lodging, meals, childcare. If you maybe didn't have to pay for childcare before, but now need to pay for childcare while you go to treatment. Some patients need help with chores, housekeeping, things that they maybe would have been able to do before, but now need assistance, and oftentimes find they have to pay for that. Many of our patients also have a reduced overall income, household income. That might be the patient themselves or other household members that contribute to the overall income. And so we'll see that reduction in overall household income, but an increase in expenses, which is really what leads to a lot of that stress that our patients experience. And again, that might be initially with a diagnosis, or it may come over time.
So planning ahead, one of the best things you can do is speak with your insurance. Call the insurance, maybe call your HR at the employer, whomever maybe has a good grasp and understanding of your insurance. You're wanting to learn a little bit about what your deductibles are, what your max out-of-pockets are. You also want to learn a lot about where are your medical facilities that are in network and where are your medical facilities that are out of network. The key here is that you need to take the reins of learning what your insurance benefits are. Another good thing when you're calling the insurance is to ask if you can have a case manager. We talk a lot about that in some of our other sessions that we've presented in. These case managers can really be very helpful in helping you understand your benefits, but also answering questions if you run into any insurance bumps, denials, claim issues along the way. Identify your financial concerns. What are your financial concerns today? What are your financial concerns that you've had most recently in the past? And what are those financial concerns that you might have going forward? We understand you probably can't predict everything that might come your way, but kind of having a little bit of what ifs or forward thinking is going to be important. Create a budget and create tracking. This is probably one of the most frustrating things for our cancer patients is you're getting all of these bills in the mail. Some are something called an estimation of benefits. Some actually say they're a bill. You may have gone to more than one medical center, so now you're getting bills from multiple places. Your insurance might be sending you something. And so finding a way to budget and stay organized and track all of that information, binders, boxes. I have patients that'll use boxes to keep track of all of that. But creating a budget and staying organized are really important. And then seek out resources that may be helpful to reduce those costs. This is where Angie's role and her colleagues in the Patient Navigation Center, certainly myself and my colleagues as social workers at medical centers, also calling your insurance and just asking, gosh, do I have financial support through my insurance or through the institution that I'm seeking care at to get any help with lodging, parking, gas, some of those expenses that you don't typically pay for? And then reach out to others and ask for help early. Others can be a wide variety. It can be people you know, family or friends. It can be church members or church communities that you know. It can be the Veteran Center if somebody in your family is part of the VA system. And it can certainly be your medical care team members. So this is a really good time to reach out, ask others. We know that's not easy for every patient to maybe be the person reaching out for help. They may be always the person giving the help, but certainly it's important to, and it's very appropriate to ask for help. And please do so early. The more we can plan ahead with you, the easier it's going to be to find those resources and mitigate a crisis situation. And then managing budgets. This is very complicated. It's complicated when you don't even have cancer or a medical condition. So again, calling your insurance, talking to your HR. I kind of tease patients. I'm like, if you're a hoarder like I am, and you keep your documents from year to year and what your insurance is, dig those policies out. Know what your out-of-pocket maximum is. Talk to financial representatives within the Mayo Clinic business office. You can do that by phone, but I actually always encourage patients to feel free to walk down to the offices on the campuses you're seeking care at and do that face-to-face interaction. Sometimes that can get information to you more concretely, more accurately, and more timely. It's also going to help you avoid that 30-minute hold that we all despise. Don't ignore the medical bills. We talked a lot about this in one of our previous sessions. Again, we know it's overwhelming when you're getting all of this stuff in the mail. We know those bills are going to look really large and scary, but please do not ignore them. Please talk with your medical institutions, your insurance, create a payment plan, create a budget with your bills and other expenses at home. Understand your current budget and debts. Explore strategies to pay bills. Seek out assistance programs. So there's a lot of different assistance programs out there. They may be through the medical center where you're getting care. They may be through community resources that you know about, faith communities, family or friends. It can be national resources like cancer grants that are out there. It can also be, there's a great medication assistance program out there through many of the pharmaceutical companies. And then there's also some debt counseling out there that we can get you linked to if you're interested. Payment plan options as well, certainly with the business office here at Mayo and with other institutions, are great ways to help you manage debts. Angie, did I forget anything? Anything you want to add?
I think you covered it all well, Amy, and actually it kind of segues nice into the next slide where we talk about sort of the creative ways to kind of reassess the income and where we have resources available. So many times we'll have patients come to us as patient navigators or social workers, and they'll say, look, I'm behind on rent and I need help paying my rent or maybe my utilities. Sometimes there's programming and resources available for that specific need, and sometimes there's not. So sometimes we just have to really get creative and say, what is out there for grants and resources and programming, and let's apply for that. And if we can get things like medications covered, or maybe we can get groceries covered, or we can maybe get gas or airfare covered, then that's money that you would normally put towards those expenses, we would reallocate and put towards household bills. So when we say about getting creative with income and kind of looking at that whole picture, that's really what we mean. And so to really have a conversation today is really difficult. It's more just saying, look, this is how we're going to talk to you individually. As you can see, this would be very personalized approach. We're really going to look at what expenses does each individual patient have based on your needs and your diagnosis, what programs and resources are available. And then we just kind of start putting the pieces together and start kind of coming up with a plan, and we will work together as a team. So many times there are some things patients can do, as Amy mentioned, where they need to do some things on their own. But then we also have programming, where you need to actually have the social worker do some applications, or navigators do applications. And so we're really working together as a team, and kind of coming up with sort of that plan, and we will help you along the way. Sometimes we do need to look at retirement funds. Patients will come to us and say, hey, I've got these retirement funds. Is now an okay time to cash into that? Or is that the smart and right thing to do? I think Amy would probably agree that's out of our scope. We're not really financial planners, but as Amy mentioned, we do have access to resources and programming where we can get you connected to those experts that can help you make those decisions and weigh the pros and cons of cashing into retirement, or things like the reversed mortgages, life insurance policies. All of those things are things we may consider. But a lot of times that's the first step patients jump to. And we want to first make sure we've exhausted all other options and resources, grants and programming before we look into some of those. And really starting with that open dialogue is where we want to start. And then some patients will have fundraising opportunities that, close family, friends may decide they want to start a GoFundMe, or some type of hold a benefit or a silent auction in the community. And those are all great things to allow them to do. But again, that oftentimes is a one-time thing. And so the money that you get from that, you sort of have to budget and sort of spend over a period of time. Or some patients use the money raised as a one-time just to cover a lump sum of expenses. But it's not something that usually is ongoing that you can depend on for income monthly. So when we say we get creative, we really truly do get creative. And it is a very individualized patient approach. Amy, what would you add?
I wouldn't add much other than to say this definitely is individualized. That there's no same decision for each family system and each patient system. If you have an accountant, know an accountant, have a financial person in your life, in your family system, or you are actually well connected to somebody in the finance system, this is a good time to lean on them, because they can kind of help you understand, instead of taking out maybe all of your retirement funds, if I just take out this much, does that change taxes, fees, some of those things? Or maybe there's tax laws that can help you think about not having such a major hit to those tax implications. So I guess I would just add that. Use those people in your life that you already know that are good with finances to just say, help me look about this, help me think about this. All right, Angie, that's what I would add.
All right.
So as we move on, we're moving on to talk to your cancer care team early. And do this if concerns arise in paying your bills, concerns about cost of medication. This can be oral medications or IV medications. Other expenses arise that are costly and cost prohibitive, or as this topic is all about, financial toxicity. potential loss of job, potential loss of income, or a loss of your insurance. Often patients will say to me, gosh, why do I want to tell my doctor this? They don't, this isn't their world. This isn't their scope. We know that. But they do know people who it is their world, who it is their scope, who they can connect you with to sit down, whether that be myself or colleagues across the institution, whether that be Angie and her navigation team, who can talk with you and say, hey, let's think this way, let's talk this way, let's look at this. Whether that be using pharmaceutical companies to help pay for some medications, whether that be looking at short-term disability, long-term disability through your job, FMLA, whether that be Social Security disability, whether that be looking into COBRA coverage for insurance, or maybe a life event allows you to switch onto insurance with a spouse. So we all are here to help you. The earlier we know, the better we can help you and your family intervene. And again, you have a support from your team. Again, just reiterating, express those questions early when they arise, exploring resources like we just kind of talked about. And then who can help? We kind of talked a little bit about this again. Your cancer care team, those business office financial counselors, they're often hidden behind the scenes, but there are some business office representatives on all of our campus that you can meet with in person. A clinical social worker like myself and colleagues, patient navigators like Angie and her wonderful team, and then patient account services as well. Angie, would you add anything?
No, I think you covered it well, Amy. So a little organization goes a long way. We did kind of talk about this in previous presentations, but again, I think just to highlight is what we really want to stress is make sure you're paying attention to your bills and not ignoring anything. If something looks unusual, please speak up, bring it to someone's attention. It could have been an error or a mistake, or it could be just something that maybe we need to further explain so that you understand what the charges are, and then we can move into looking for resources that might be available to help. When we list here, submit claims promptly, even if you aren't sure if they're covered, just please, I think the thing I want to stress here is that you're not responsible as a patient to submit any of your claims for your medical expenses. Really what we're highlighting here is if you have a flex spending account or a health savings account or an Aflac policy or some of those cancer policies that they require you to submit documentation, receipts, paperwork, so that they actually pay you back or reimburse you. That is what we're asking you to keep in mind, because for all of those policies, there are deadlines and timelines that you need to make sure that you meet. You can't turn expenses in like a whole year later and expect to get reimbursed when you're all done with treatment. It is something we encourage you to keep up on. And so that's again where we would encourage you to look for a trusted family member or friend that could help you in keeping up with those submissions. And then making sure you just kind of keep all that paperwork together. Again, if you want to be as organized as sorting out everything by month and filing it in a binder, if that's the organization style you prefer, have at it. I would say not all patients function that way. Not everybody functions that way. And our patients more specifically just don't feel well enough to do all of that. And so if we can just get it all into one spot, if you can have it kind of like Amy said in one box or one area. So if we do need to go back and look for anything, you know where it should be. So things like the letters of medical necessity, if you get any documentation from your insurance company, any letters that your medical provider gave to you, explanation of benefits, bills, receipts, paperwork for leaves from work, all of that should be kept in that one location so that it's easy to reference. Amy, anything you'd add?
Yeah, Angie, if you want to hop back a slide, I would add in this area where it says submit claims promptly. I would also add for anybody listening that happens to be on Minnesota medical assistance or a different state Medicaid medical assistance program, the same is true for your county. There sometimes can be some benefits through your county that need to be submitted timely and promptly to get that one. One good example is mileage reimbursement. For our Minnesota people listening that might be on Minnesota Medicaid, they do have a time frame for which they'll only approve that. So do kind of pay attention to that. And then the other thing I would add, something we talk quite a bit about in one of our other sessions under keeping copies of all your paperwork, you may ask your employer for an accommodation so that you can continue work but have some adjustments in your work hours or maybe the type of work you're doing. And often I always tell patients, get that in writing from your supervisor if your employer does give you an accommodation. And I'd refer you back to one of our previous slides. We talk a lot more about that in that, but or sessions, I should say. But I just wanted to kind of give a little bit of a highlight to that topic in this session as well. That's what I would add, Angie.
Thank you, Amy. Excellent point.
And as we start to wind down to this session, we're going to just kind of finish off here with a checklist to navigate your financial cancer care. So as we're just going to kind of read through these here, gain an understanding of your insurance terminology. That is session 1 of this 3-part series. Know your insurance policy and benefits. Again, what are those deductibles? What are those max out of pockets? Stay organized with your paperwork. We know that that's not easy to do, especially if it's not an organic personality trait, but anything you can do to even just keep it in a binder, keep it in a box, or in the same place on your kitchen island, kitchen table. Be aware of insurance denials and appeals process. Ask for help along the way from your cancer care team. Again, we talk about this a lot in session 1. We know you're going to get some denials. We expect that. We apologize in advance. Unfortunately, this is kind of just the back and forth of medical institutions and insurances. So know what's happening. Let us know if you endure a denial or need to pursue an appeal. We're happy to do it. We know the process and we're here to help. Don't ignore those bills. That's a really big one. I feel like an exclamation point could be behind that. Ignoring bills can jeopardize not only your financial stability of your household, but also accessibility maybe to medical care. Keep a record of your bills and inquire about resources and available assistance. Track your overall household spending. Be aware of your employer's policies and benefits that you're eligible for as an employee. This is the core concept of our second session. Things like FMLA, short-term disability, long-term disability. Avoid a loss of insurance coverage. Again, a gap insurance can really not only be financially toxic to your household, but it can hinder accessibility to medical care. Should you lose your health insurance, we've got COBRA as a main option through your employer if you have insurance through your employer. But there's also insurance options like Affordable Care Act. This is a life event of a loss of insurance. Maybe you can jump onto a spouse's insurance. So understanding your insurance coverage, your insurance options that are available should you lose your insurance. And then discuss financial concerns with your care team as they come up so that we can address them in a timely manner. Again, I know it probably seems a little weird to be saying to my doctor, hey, I'm about to lose my insurance, what should I do? But they know who you should connect with and they will help you find that person. And that is true and valid across any medical institution you're seeking care. That is not just a Mayo Clinic thing. We pride ourselves in working as a team here, but I'm hopeful that the other medical institutions across the country feel the same way. So we're all here to help you. Angie, things you'd add?
Yeah, no, thank you, Amy. I don't have anything to add other than we understand this checklist might be really helpful for many of you listening in. And so we will be posting this as a standalone document with the webinar recording. So you will have access to this checklist if you'd like to go ahead and print that off and use this for your own reference or your use. So I think we'll go ahead and move into the questions and answers.